Hey everybody! So just got off the phone with a potential new patient and just talked to them kind of about my approach for some cervical spine issues, so some stuff in the neck. And I wanted to take this opportunity to kind of walk through my thought process on some of the more common issues that we see with the neck. And so one of them is a loss of lordosis. And so lordosis means that's the natural the C curvature that we have in the cervical spine and also in the lumbar spine. That over time we can lose that. And so basically what that means is we turn from so this is our C curve here in the lumbar spine. This one here doesn't have this actually shows a really great loss of lordosis. So we see in the lumbar spine, we had a nice C curve. In the cervical spine, and this model here, we've actually kind of lost that and it's straight. And so that's what we call a loss of lordosis. And so that would be in the cervical spine. Now, that on its own doesn't always cause issues. There's lots of patients walking around who have loss of cervical lordosis and they have no pain, no symptoms, nothing like that, and it's not a major issue. And so in those patients, I don't typically do anything for treatment because they don't have any symptoms, and I'm not just going to perform a procedure based on an image finding. Now, if a patient is having some foraminal stenosis, some central canal stenosis. So that's basically narrowing of either the intervertebral foramen, which is on the outside here, which is where the nerve roots come through, or the actual central spinal canal where the spinal cord is going through. We can have some narrowing in those when we have loss of lordosis, because from our curvature, that's how we have maximum opening of those areas. And then when we lose that, we can have some flattening or some narrowing of those areas. Those can cause some neurological issues, more if it's centrally. Obviously, we get a flattening of the spinal cord, or if it's laterally in the intervertebral foramen, we can get a closing down or an impingement of the nerve roots, which can cause pain, weakness, fasciculations, stuff like that into the extremities, upper extremities. And so one of the ways that we can approach this loss of cervical lordosis is actually by treating the posterior aspect of the neck, okay? And so when we look at our model here, we have ligaments that run in between all of these levels of the spinous processes. We've got ligaments that run in between the actual articular pillars here. And obviously there's muscles in the area, but these ligaments can become damaged. They can become weaker. And a term that we use for that is called ligament laxity, where the ligaments are looser than they should be. That over time can contribute to a loss of cervical lordosis. And so if we come in and we can treat the posterior aspect of the spine here and in here with PRP, prolotherapy, some stem cell therapy, basically anything that's going to cause some healing in that area, some strengthening of the ligaments, what we essentially do is we can tighten all of this down here, which will put a curve back into the spine. And it may be only a few millimeters or a few degrees of difference, but that could be the difference between a patient having symptoms and not having symptoms. And so that's generally the way that I'm going to approach a loss of cervical lordosis. Obviously, that is going to be combined with some really great physical therapy that's designed to help train the neurological system to maintain that position when we're not thinking about it and things like that, because all of that factors in with how the muscles and the brain and the nervous system are talking. But that is how we approach here at Regenerative Performance, loss of cervical lordosis that is contributing to symptoms, whether in the neck, in the arms, or centrally, anything like that. All right, everyone. Hope you have a good day.